Hi everyone, in this video we will be studying about glycogen storage disease. It is the most important topic for the exams. So we will be studying what are the enzymes and what are the findings in each disease. First one or type 1 is von Gerke disease. In this increased glycogen in liver, increased lactate in the blood, triglycerides and uric acid occurs and hepatomegaly and renomegaly is there. And what is the enzyme? Glucose 6 phosphatase. And there is severe fasting hypoglycemia, so we require frequent oral glucose or cornstarch, avoidance of fructose and galactose, and both the gluconeogenesis and glycogenolysis, as the glucose 6 phosphatase is required in both the processes. So both gluco and glycogenolysis, neogenesis and genolysis are impaired. Then type 2. Type 2 is Pompey's disease. Pompey's disease, let's remember it as pump's disease. So in the pump is impaired. That is, heart is impaired, cardiomyopathy will be occurring. Hypotonia due to muscles, exercise intolerance, and enlarged tongue are there. And what is the enzyme that is deficient? Alpha 1 4. Four letters are there in pump. Alpha 1 4 glucosidase. Alpha 1 4 glucosidase or acid maltase are deficient. Then in Cory's disease, Cory's C for Cory's and C is related to D. So C is related to D branching enzymes. Cory's is related to D branching enzyme, that is alpha 1 6 glucosidase. Which is coming first? That was alpha 1 4. And in this type 3, that is alpha 1 6 glucosidase, and it is similar to von Gerke's normal blood lactate levels and can lead to cardiomyopathy. Due to debranching defect, the limit dextrin is deposited here. And here, why it is milder than the von Gerke's? Because gluconeogenesis, that is synthesis of the glucose, is intact. Only the debranching is not occurring. And what is the test we do for this? If we give glucagon 2 hours after the carb meal, then it will increase the blood glucose, because the glucose will be present in the food in the large size particles and that can be broken. But if we give glucagon after overnight fasting, then only the limit dextrin was that which was left. All the large particles have been degraded, so no further rise in blood glucose will occur. Then we have Anderson disease, Anderson or type 4 disease, and Anderson is related to A, after A comes B, so it is related to branching enzyme defect. That is all about the Anderson. Don't need to remember all the other things. Then is McArdle's disease. McArdle's is type 5. And M for McArdle's, M for muscle phosphorylase. Muscle phosphorylase is defective, myophosphorylase. And there will be painful muscle cramps, myoglobinuria, arrhythmia, and second wind phenomena due to increased muscular blood flow during the exercise. Second wind phenomena, and it is characterized by flat venous lactate curve with normal rise in ammonia levels. Means venous lactate will not be rising, but ammonia will be rising. Then next, type 6 is not mentioned here, but type 6 is Her's disease, and Her's disease is linked with the hepatic or liver phosphorylase. Then what is mentioned here, read that also. Von Gerke's hepatic adenoma, carcinoma, and renal failure can occur. Then Cory's disease, or also known as Forbes disease. In this, liver cirrhosis, that is, liver cirrhosis can occur. Hepatic adenoma, carcinoma, which was occurring in von Gerke, can also occur, and liver symptoms improve with the age in the Cory's disease. Then 3B is liver debranching enzyme, normal muscle debranching enzyme. If we mention about 3B, 3B is means one enzyme is not defective, that is muscles one enzyme is not defective in the Cory's disease, then it is known as 3B. Then 6 is Her's disease, hepatic phosphorylase linked with the hepatomegaly, and variable hypoglycemia will be there. Hyperlipidemia, ketosis symptoms may improve with the age. Seventh is due to phosphofructokinase M subunit, also known as Starrow's disease. 12 is Fanconi's disease, glucose transporter 2, rickets, hepatomegaly, and proximal renal tubular dysfunction. And 0 is due to glycogen synthase. See what enzymes are we have read are related to the degradation of the glycogen. But if it is related to glycogen synthase, so it will be coming before all the diseases. So it is type 0, glycogen synthase, and fasting hypoglycemia, ketosis, elevated lactic acid, and hyperglycemia after glucose. Decrease the glycogen store. So what extra we have mentioned in this page is 0 is glycogen synthase deficiency, 12 is linked with the GLUT2 and also known as Fanconi's or Bickel's disease. Seventh is related with the phosphofructokinase M subunit. Sixth is almost that related to that page only. And that is all the extra we have done in this. So that is all crisp and concise what we need to remember about the glycogen storage disease.